COVID-19 on the African continent was far worse than the actual reality we're seeing. Now, this has given rise to what's known as the African paradox. While the youthfulness of the continent can offer some reasons to the death toll being lower than expected, it doesn't completely account for this discrepancy. So what is really going on the African continent, and what does that experience of COVID-19 teach us about the disease and, in fact, about ourselves? Well, to help us answer these questions, let's bring in Dr. Mary Stephen. She's Technical Officer at the World Health Organization's Regional Office for Africa. Doc, thanks very much for your time. Great to have you on the program. I remember at the onset of the outbreak, fears and alarms being sounded the world over about how if COVID-19 were to arrive on our continent, that would open the floodgates, so to speak, to absolute carnage. We're not seeing that, but are we any step closer to finding out why?
Yeah, thank you for having me. It's true that at the beginning of the outbreak, most of the countries around the world were worried about Africa for a simple reason, because our health system is not as strong as what you find in other parts of the world. So this was part of the reason why they were concerned that Africa could easily be overwhelmed by the COVID-19 outbreak. But fortunately for the continent, the early actions that government took with regards to the COVID response and all the measures implemented has helped to slow down the progression of the outbreak on the continent and averted the predictions that we had for Africa at the beginning. So it was not accidental. It is part of the actions that were taken on the continent that contributed to this outcome that we are seeing.
Part of the perspectives entering the debate is that part of the reason we're seeing these low numbers is because Africa doesn't have the capability to track COVID-19 in the ways in which the global north does. How much credence do you think that perspective has?
Okay, so with regards to that, on the continent, yes, we know how to do surveillance. We have been implementing what we call the integrated disease surveillance and response for the past 20 years. So we know how to do surveillance. Part of the challenge is laboratory testing, but this is not limited to Africa. Globally, testing has been a challenge because of the availability of the reagents, and so countries in Africa had to come up with testing strategy that best give them the opportunity to test the people that are in need of that testing, and they kept readjusting that testing strategy according to the capacities on the continent. So yes, there was a challenge with testing, but it doesn't mean that we don't know we don't have the capacity to do surveillance.
I'm interested in the idea of age entering the discussion. Africa being seen as having a relatively younger population than many other regions across the world. Is that something that you think might give a lot of, I guess, explanation to why we're seeing the pandemic unravel in the ways that it is? Mostly because we know that younger people were thought of as not necessarily exhibiting severe disease against this virus.
Yes, so in terms of infection, everyone is at risk. Everyone is at risk. But when it comes to the issue of development of severe disease, we know from statistics that older people and people with comorbidities, these are the age group that are likely to have poorer outcomes when it comes to the COVID infections. So yes, you are right. One of the reasons why we didn't have so many admissions like what we have seen in other parts of the world is partly because we have a younger population, and even the comorbidities we have on the continent is not as much as what you find in other parts of the world. But when you look at the issues of the risks of infection, definitely all age groups are at risk of infection.
I remember, and this is not to give more weight to conspiracy theories around COVID-19, but at the onset of the pandemic, we had heard people making a differential according to race, right? This perception that black people are less likely to fall more ill, etc., etc. You're the expert. I wonder if science corroborates this and if it helps us understand why the pandemic is unfolding the way it is on our continent.
Okay, black people. So there is no evidence to show that because you are black, that you are at reduced risk of contracting the COVID, or that because you're black, you cannot get a severe disease. Really, there is no scientific backing for that. And if you look at what is happening in the United States, for instance, unfortunately, the minorities, the black population, the infection was higher among them, mortality was higher among them. So I don't think that theory holds true. There is no evidence to support that. But like I said earlier, you know, your ability to cope or to contain an outbreak depends on how early you took your action. And this is one good thing that the countries in Africa did. The actions were taken early enough. So despite the fact that we have a weak system, we were able to manage and cope like this exponential spread of the disease as we have seen in other parts of the world.
Yeah, and you know, Doc, you laugh, but it's been a real, call it, pillar that people have been leaning on to try and explain what scientists are struggling to explain now. But it's great to put it to bed. Science, at least, hasn't given us an idea that race plays a role. Interesting, you also mentioned the idea of early intervention. South Africa also being lauded by the World Health Organization for doing exactly that. However, we're seeing South Africa having the highest caseload on the continent. That appears to be slightly, call it, paradoxical in and of itself.
Yes, so at the beginning of the outbreak, if you look at all the countries that had initial cases, South Africa is one of the countries that had the highest number of initial cases. So just look at the early countries, starting from Egypt to Nigeria, to all other countries, including South Africa, those early countries that started having cases. Most countries, they will have 1-2 cases. For South Africa, there were lots of cases from lots of different countries coming at the same time. So this was part of the thing that contributed to increase and spread of the disease. And there are other factors as well. You went through the winter period, and a lot of challenges that could enhance or facilitate the spread of the COVID-19 outbreak. So this is part of the things that is a little bit different in South Africa than what you find in other parts of African countries at the initial stages of the outbreak.
And for those who are struggling to connect the dots, Dr. Stephen, why is it important to try resolve the supposed African paradox? I imagine a situation where people just accept that perhaps Africa is lucky, and that's perhaps lazy thinking, but a perception that's out there nonetheless.
Yes, I don't think luck is the right word. I think we have to acknowledge the interventions that African countries did at the beginning of this outbreak. We need to acknowledge that and commend the effort of government, because countries were not sleeping. If you remember at the beginning of the outbreak, some countries, even with the first case, they already went ahead to start closing their borders. And of course, implementation of the public health measures, the surveillance we are talking about, issues of contact tracing, treatment, isolation. I remember in Africa, it is one of the continents where we had even people that were asymptomatic at the beginning of the outbreak were being treated in facilities because of the peculiarities of our societies. So these actions that government took, we need to commend them for that effort. And secondly, yes, I agree with you that there are some questions that are still not answered. We need to continue to research and understand, but definitely there are things that we know that has contributed to slowing down the progression of the outbreak on the continent, and that has to be acknowledged, and we have to commend the effort of countries in Africa.
Yeah. A lot of the focus now, Doc, of course, moving to the vaccination drive that hopefully will be well underway across the continent. We're seeing some countries still lagging behind. How much of a concern is that for you?
Yes, so for the vaccination, on the continent, African countries are part of the COVAX facility, and the COVAX facility is expected to provide a vaccination that will cover a certain percentage of the population on the continent. So being prioritized for health workers, the people at high risk, people with comorbidities, older people, but there is also the vaccination availability or vaccines availability from the Africa Union platform that will complement the COVAX facility. So the goal of the COVAX is to ensure that we have equity in terms of distribution of vaccine. So we have seen quite a number of countries in Africa have received the vaccines from COVAX facility, and the remaining countries also have the schedule for distribution of the vaccines. But we know, of course, that definitely this has to be complemented. This is where the AUC effort on the vaccination also is important to complement this so that we can have a larger population covered for us to get to that level of herd immunity to interrupt the COVID transmission. Yeah,
what is perhaps concerning, though, is that herd immunity won't come around before the third wave does. In fact, the Director General of the WHO, Dr. Tedros Ghebreyesus, in a recent address just yesterday, being at pains to explain that we absolutely not out of the woods yet. Perhaps even this concept of the African paradox could be shattered by the time we reach our third wave. Are we better placed as a continent to respond to the third wave when it arrives?
Yes, I think we have come a long way in this COVID-19 response. We have learned a lot. We have seen what is working, and we know what is not working. And we know that there are proven preventive measures that can help us limit the spread of COVID-19 and also prevent this third wave or even delay it. We know that when we put in effective public health measures of testing, contact tracing, the surveillance, treatment, isolation, preventive measures, wearing our masks, the issue of hand washing, keeping our distance away, avoiding unnecessary mass gathering. These are measures that we have seen that are effective, even without a vaccine. But the vaccine brings an advantage to us. So in addition to the vaccine, we have these measures that we can continue to implement and improve on those as we continue to vaccinate the population. Yes, it's going to take a little while for us to get to that level because we know that the current amount of vaccine, at least up until the end of this year, will not get us to that level of coverage that we require. But definitely, even with the vaccine, we need to continue to implement those preventive measures, those sound public health actions for us to limit further spread and potentially reduce the impact of a third wave or even prevent a third wave from happening. So yes, I agree, we are not out of the woods, and we know things that should be done for us to avoid or avert a disaster that might come in the future.
Dr. Stephen, let me thank you for your time. Really appreciate your insights on our program. Dr. Mary Stephen is the Technical Officer at the World Health Organization's Regional Office for Africa. Doc, thanks very much indeed.